Hello, this is Dr. Stanley Lang. Welcome to this broadcast, and the topic is how to reverse diabetes type 2 with a safe ketogenic diet. So there's several key words there: diabetes type 2, not type 1, and ketogenic and safe ketogenic. So I'd like to tell you about a patient that I saw today who I first saw 10 months ago with a new diagnosis of diabetes. She'd been admitted to the hospital. She'd had a lot of complications. And she was seen for the first time about 10 months ago by myself, at least. And at that time, her diabetes tests suggested she'd been diabetic for a while. But like many people who are slowly becoming diabetic, not having enough symptoms to become aware that something was wrong, and so she really hadn't sought any attention until she got sick enough to end up in the hospital. Then the diagnosis was made. So when I saw her back, or when I saw her the first time, I gave her some options, including the ketogenic diet. She definitely wanted to not use medication. That was her number one goal. And here she was on 4 medications already, and she didn't want to be on any medication. So she's on 2 for blood pressure, 1 for diabetes, and a statin drug for cholesterol. So we reviewed her options. She decided that she wanted to try the ketogenic diet. So I explained it to her and gave her resources. She started on her merry way. And within 4 months, she had dropped her A1C down to the 5.8 range, 5.8. And that was still with the diabetes medicine on board. Since then, she's off the diabetes medicine, and without needing the diabetes medicine, her A1C is down to 5.5. Now, during that time, she's also jettisoned her need for blood pressure medicine. She's not taking any of that. She's not taking the statin drug because the main reason that she was put on the statin drug is that it's kind of medical convention that every diabetic patient is supposed to be on a statin drug because diabetes is considered an equivalent to active coronary artery disease. So for that reason, doctors generally put all diabetics on statin drugs. And so this patient was on that too. So she's able to stop all of these medicines because she's been able to reverse her diabetes. In other words, she's got nothing left to treat medically. Now, clearly she's still managing it with her dietary and lifestyle strategies. So I wouldn't say she's cured. I'd say she's on the way to complete reversal. We'll know in another year whether she's completely reversed it. But these are pretty dramatic changes. And during this time, her blood pressure, as I mentioned, has also come down to normal. The weight loss is 57 pounds in 10 months, and blood pressure is down to normal. And she's been able to stop all 4 of these medications. Now, in my world, that is a huge success because this patient has not just eliminated her need for medical care, which is a good thing if you can do that, but she's restored her body's chemistry back to normal. She has a chance for normal aging the way God intended it to happen. And I want to point out that this person is over 65 years old. I'm not going to give her exact age, just say she's well over 65 years old. So this isn't something that only young people can do. Anybody who can walk around can do this kind of a program. In fact, one things that she admitted to is that she's not doing enough exercise. She's not following my exercise recommendations very carefully, although she's following my dietary recommendations extremely carefully, which is why this is working. If she had instituted the exercise, which I'm sure she's going to do now, she would have had even more progress and she would have felt even better than she does. And she feels better now than she has in 15 years or more. So part of the program involves some advanced nutritional supplementation in addition to eating correctly. And when I say safe ketogenic diet, that does imply that there's some unsafe strategies out there. And I won't get into all of the details that make it unsafe, but one of the things that I commonly seen is that the essential fatty acids are underrepresented in what the person is eating. Now, this is kind of a paradox in that the person is already eating a 70% fat diet or more, yet they still don't have the right fats in their diet. So having the right fats is important for long-term health in a ketogenic diet. If all you're after is short-term gains, then you can eat pretty much any kind of mixtures of fats without any big negatives. But if you want long-term health, you need to have the essential fats at the right dose. So I hope if you're diabetic or pre-diabetic or you've got weight issues, that you find this story encouraging, because you can do it too. It's not hard to do. It's just something you got to decide to do. And if the ketogenic diet is too much for you, it's too big of a shift, just eating low glycemic, very low glycemic, which is still mainly carbs and not mainly fat, would accomplish almost the same goals, not quite as fast. I've seen that happen many times also. So either way, you can reverse diabetes, but you can do it the fastest with the ketogenic diet. And my encouragement, again, is to do it safely. There's a lot of strange versions of the ketogenic diet floating around out there. And if you do it for the long run, you're going to pay the price metabolically and in other ways for missing out on key nutrients. So I wish you well, God bless, and have a great day.